Hello, I am Dr. Terry MD, your board certified neonatologist and pediatrician, and I specialize in the care of sick preterm infants as well as term infants. And I have a mission to train healthcare providers as well as staff to empower families who have to make difficult choices for their infants as they navigate the NICU journey and receive the gift of hope. So that's my mission really, is that every family that I come into contact with would receive the gift of hope. And I'm trying to do that through live streams, through my public speaking, through my courses, as well as my webinars. So I'm really excited about this week's live stream and really excited about those of you who have been able to join me. I'm trying to do something different today. I'm being outside and it's a little hot today in Texas, so this may be the shortest live stream ever, but I'm not going to complain about beautiful weather because, as you guys know, we've had to deal with a lot recently here in Texas, and we're dealing with a lot in Florida as well as in the Caribbean. And I just want to thank God for sunshine today, and just continue to keep those families in prayers who are dealing with the recovery efforts. So I'm Dr. Terry MD, and this is day 3 of NICU Awareness Week. Yay, NICU Awareness Week. And so Monday, we had a chance to talk about newborn screening, and we received really good feedback from that. And then Tuesday, yesterday, as you guys know, we talked about the most common problems that we see in our babies that are in the ICU nursery, both term babies as well as preterm babies. So today, I wanted to talk about the most common questions that I get from families who may have a baby in the NICU. So I think that today's topic really would apply to any parent, because if you are a parent and you have a baby that's sick, obviously you're going to be very frightened and you're going to be very concerned and really want to know what's going on with your baby and want to know about outcomes. And so those things are magnified, obviously, when you're in the ICU nursery. So I had asked earlier for you guys to kind of think about, what do you think the most common questions are that families who have a baby in the ICU nursery might ask the provider that's in the ICU nursery? So the first question that most families ask when they have a baby that may be going to the ICU nursery is my baby going to live? And is my baby going to be okay? So they often ask that question simultaneously. Is my baby going to live? And is my baby going to be okay? So that is really the most common question that most families will ask. And that they often ask that question during the prenatal consult. If you know the baby's going to be sick or have to come to the ICU nursery, they will ask that question then, or during the delivery, or certainly once we're entering the ICU nursery. Is my baby going to live? And is my baby going to be okay? So obviously, we do have to take care of some babies that unfortunately, despite our best efforts, they will not survive. And that's always very hard. But the majority of the babies that we take care of in the ICU nursery will survive. Hi, Carla. So the majority of the babies that I take care of in the ICU nursery will survive. And the majority of those babies will get to go home. Now, obviously, if you're very premature or you have significant problems, then you may have some complications for that. So the first answer to that question is the majority of our babies that come to the ICU nursery will survive. Now, that doesn't mean all the babies, and obviously, the more premature the baby is or the sicker the baby is, the more likely they are to have complications. So neonatology is a relatively young field. So we're saving babies now that 10, 15, 20 years ago we were not saving. So we're now offering care in some of our institutions to babies as young as 22 weeks. So there's a range from 22 weeks all the way up to 40 weeks for babies that we take care of. And obviously those babies that are smaller will have a higher risk of not surviving and having complications. But I'm happy to report that the majority of the babies that we see in the ICU nursery are not the teeny tiny 1-pound miracle babies that you see on TV. The majority of the babies that we take care of in the nursery are the bigger preemies. So really those preemies that are between 28 and 34 weeks, those preemies that are between 3 pounds and 5 pounds, and yes, we consider 3 pounds a bigger baby. So the majority of those babies will live. And so when I am meeting a family, obviously I look specifically at the case for their baby and talk about the ranges. And then we always kind of mention that we have to evaluate day by day because every baby's different. But the majority of the babies that do come to the ICU nursery will survive across that range. Now, is the baby going to be okay? So I'm always concerned when a family asks me if the baby's going to be okay, because okay means different things for different families. So what do we mean as a parent when we say, is the baby going to be okay? So first they want to know, is my baby going to survive, doc? You know, is my baby going to survive? And if my baby does survive, is my baby going to have an okay quality of life? Is my baby going to be able to walk? Is my baby going to be able to talk? Is my baby going to be able to independently care for himself and participate in society? So these are questions that many, many families will have once they kind of catch their breath and realize, okay, my baby's alive, my baby's going to survive, but really, is my baby going to be okay? And that okay looks different for different families, and different families make different choices with the same scenario. So we usually speak to families one-on-one about their specific concerns and wishes for their baby, and what types of services, if any, their baby may require, or what type of support that their baby may require. So that's the first question. It's kind of lumped together. Is my baby going to be okay? And is my baby going to live? So that's usually the same question, okay? So the second question, most parents, if you've had a normal baby, will not even think about this question. But if you've ever had a baby in the preemie, in the NICU, and especially if you had a micro preemie or a really tiny baby, they all want to know, when am I going to be able to hold my baby? Can you imagine that? Can you imagine having your baby and actually having to wait to see when you can hold your baby? And most NICU moms, no matter how old their child is now, their child may be 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 20. They can tell you how long they had to wait to hold their baby. They know if they had to wait 2 weeks, 5 days, 3 weeks, 2 months. They know how long it took before they actually got to hold their baby in their hands. So that's usually the second question, Doc, when can I hold my baby? So even if you have a 1-pound baby, it is our intent for you to be able to bond and hold your baby. It is our intent for you to be able to have kangaroo care so that you can participate in that bonding experience where the baby will have skin-to-skin contact with the mom. Those are our intentions. But obviously, if the baby's really, really sick, we have to kind of wait until the baby's more stable. And so for many babies, they will have to wait until they don't have IVs anymore in their umbilical cord. A lot of babies will get the IV in their umbilical cord at first, which will serve to help us stabilize the baby, give the baby medicine, monitor the blood pressure, get blood work. So sometimes you have to wait for that. Sometimes the lungs are really, really sick, and if we just touch the baby or move the baby may need more oxygen, so the parents may have to wait for that. So for each baby, it's different, but the second question I usually get is, when can I hold my baby? So the first questions were, is my baby going to live, Doc? And is my baby going to be okay? Kind of clustered together. And then that second question was, when can I hold my baby? Which always gives me pause, because I have 2 normal children. I got to hold my children immediately after delivery. My kids are only 2.5 years apart. I had a toddler and a newborn in the room, and there were times I wanted the nurse to come get my second baby so I could kind of get some sleep. So it gives me great pause to know that there are mothers who've had their babies, who had to wait a significant amount of time, mothers and fathers, before they could hold their baby. And the last question is, the reason that I'm outside today in this beautiful, glorious Texas sunshine. So what do you guys think the last question is? I'm outside. So the last question that most families usually ask me is, when can my baby go home? Or usually, when can I get the heck out of here? Like when do we get discharged? So it's actually my favorite question. We usually don't know the exact answer, but it's my favorite question because it tells me that a family is starting to exhale. They're no longer holding their breath, worrying about the worst anymore, and they're thinking about seeing their baby at home, in their family, as part of their unit. They're allowing themselves to believe those dreams that they have for their baby, and sometimes those dreams are put on pause when you have a baby that's really sick or a baby that's in the ICU nursery, and you're hearing scary stuff all the day. So it's really kind of hard to think about, hey, Sandira. It's really hard to think about, one day we won't be in the ICU nursery, and one day my baby's going to be home with me. So when they ask me when the baby's going home, I always say only the baby and God knows. Okay? It's true. Only the baby and God knows. But we do usually give them some guidelines. So one guideline is most babies go home around their due date. So sometimes people think, oh, I had my baby early, so I get to take my baby home early. No. So you had your baby in September, your baby's due in December. The baby probably will be here until December, sometimes longer than December. So it just kind of depends on the baby. So a pregnancy is 9 months, 40 weeks for a reason. It takes a while for the body to develop, for the baby to grow, for the lungs to develop, for their swallowing skills to develop, and for them to get strong enough to be able to go home and be stable at home. And so we have to allow time for that process. And if they get sick along the way, then it may be even longer. So when you have a baby early, we normally tell families that their baby will likely be there until around the due date. So most babies go home within 2 weeks of their due date. There may be 2 weeks before, so around 38 weeks, or it may be 2 weeks after, 42 weeks. We consider all of that normal. So that question, when is my baby going to go home, doc, has a lot to do with development and if the baby had any complications. Another thing that's necessary for the baby to be able to go home safely is to pass the car seat test. So you may have a baby that actually has no complications, is very stable, is eating okay, lungs are better. They get a special test in the car seat to make sure that while they're sitting in the car seat, that they're breathing okay, that their oxygen is okay, that their heart rate stays okay. And if they do not pass that car seat test, then we will continue to monitor them in the ICU nursery. Some babies will have to go home in a special car bed. Okay, so that's another thing. So developmentally appropriate with major medical conditions resolved, pass your car seat test. Number 3, you have to be able to eat well enough to maintain your weight. So most babies are born knowing how to suck. Even 22-weekers can suck their thumb or suck on the breathing tube. But to suck and swallow without choking, that reflex is not usually matured until somewhere between 36 and 40 weeks, okay? So it takes a little time for that reflex to mature so babies can actually get home. Thank you guys for joining. Thank you. I really, really appreciate it. Go ahead and share. You guys can come back and catch the beginning. We're on the last question for those of you who were thinking about what the 3 questions were that parents may have. We're talking about that last question, which is the reason I'm outside, is when can I go home, doc? When can I get out of here? So that's like the last question that I usually get, but it's the question that I love the most. And we're talking about the criteria to go home. So being more mature, developed, so closer to your due date, passing your car seat test, and being able to suck and swallow and breathe without eating. So a lot of babies are doing okay, but they're still there because they're working on nibbling. They choke every time they try to eat, or they're eating okay, but eating is burning up too many calories, so it takes more time. So for us, we eat and we just get bigger. They eat and sometimes they get smaller because they're using up all their calories and stuff. And that can be really frustrating for families. I mean, you got through the breathing problems, you got through the infection, like you got through everything, and now you got to wait because your baby has to learn how to take a bottle. And really, that's just a part of a development. And most babies will figure that out, and every baby kind of figures it out on their own schedule. Okay, so those are our 3 top things that most families usually ask. Thank you guys for joining. Just to recap, the first question that most families usually ask me is my baby going to live? And is my baby going to be okay? And like we talked about, there are specific ways to approach the answers to those questions depending on what the baby's illness is. The second thing that families usually ask, that most people, if your baby has not been sick or you haven't been around sick babies, is when can I hold my baby? And it's something as a parent that really you don't even think about, like having a weight to hold your own flesh and blood. So we have reasons for that, but it's still is very upsetting for families, and particularly for moms, and disrupting for the bonding. So it's a beautiful, beautiful day when they finally get to hold those babies. And then number 3, when can I go home, doc? When can I get the heck out of here? So discharge day. So I literally think I'm more excited than most families when they finally get to go home. Okay, so those are our 3 questions. Thank you guys for joining me for day 3 of NICU Awareness. I made it outside, and the Texas heat is only I'm only sweating just a tad, but Mother Nature was good to me. For those of you guys who are just joining the series, remember Monday we talked about newborn screening, and then Tuesday we talked about the most common problems of preemies and term babies in the ICU nursery, and today we talked about those 3 big questions from parents. So tomorrow we are going to talk about, what if my baby doesn't get better, doc? You know, my baby's sick, what if my baby does not get better? And talk about what do I mean when I say neonatal palliative care? What do I mean when I say perinatal hospice? So I think it's a field that most people are not familiar with, but it's something that's very sacred, and that I'm privileged to give to families so that we both can have hope in the midst of the journey, okay? So I'm Dr. Terry, MD. I'm your board-certified neonatologist and pediatrician, and my goal is to train providers and staff to inform families so that they can make difficult choices for their sick infants and have the gift of hope. And I think at the end of the day, we all should have the gift of hope, okay? Thank you, guys. Don't forget to share and follow me at the Dr. Terry MD page, and I'll see you guys tomorrow at 4:30 for our last segment for NICU Awareness Week, okay? You guys be well. Thank you. Bye-bye.